Hi, my name is Kamryn Oliveira, and I'm a student at the University of Massachusetts Amherst. I'm a member of the Commonwealth Honors College, and I will be presenting a thesis titled Improper Antipsychotic Usage in Nursing Homes Exposes Deeper-Rooted Issues in the System, Inadequate Staffing Levels, and Poor Worker Training. To start off, what is the issue and why do we care? The US currently has an aging population that's growing tremendously. According to the Population Reference Bureau, in Figure 1, the number of Americans ages 65 and older will more than double by 2060 from 2014. In Figure 2, by 2060, nearly 1/4 of Americans will be ages 65 and older. With this aging population that is growing tremendously, there will also be an increase in dementia cases. Due to this growing population, more care will be needed, especially in nursing homes. So what's the issue with this? My thesis argues that proper nursing home care will not be provided due to countless major issues that exist in our country's nursing homes. This includes, but is not limited to, improper antipsychotic usage, inadequate staffing levels, and poor worker training. Nursing homes promise to care for our elders, but they do not uphold this promise. Think of your family members, friends, or even ourselves in the future. It can affect so many of us. Some background on nursing homes: who are the staff and what do they do? Staff includes registered nurses, LPNs, CNAs, which are nurse aides or assistants, physical therapists, and various others. They provide direct care to nursing home residents. CNAs specifically help with activities of daily life. This includes bathing, toileting, eating, dressing, transferring, walking, moving around, and various other activities. What are antipsychotics? These are drugs that help manage symptoms of psychosis, such as hallucinations, delusions, incoherent or nonsense speech. These drugs are widely used in nursing homes to manage behavioral and psychological symptoms of dementia. However, the original purpose is for treatment and management of psychiatric disorders, such as schizophrenia, Tourette syndrome, bipolar disorder, and others. Why are antipsychotics used? They're used to manage these behaviors of dementia residents, behaviors including anger, agitation, swearing, continuous wandering, and there's many other behaviors as well. Due to these behaviors, residents can present harm to staff, other residents, or even themselves. These drugs make patients with these issues easier to handle, but sadly, sometimes it just quiets them, makes them lethargic, or even sleepy. Sometimes they are used as a form of chemical restraint, and due to this, it sedates the residents, so we can't really uncover the underlying causes of these behaviors, and we can't address them due to that. So when faced with behaviors, what do staff choose to do about this? Really, the only option left is to drug them with these antipsychotic medications. My thesis argues that due to nursing home issues, the staff do not have the proper resources, such as proper staffing levels or training, to deal with these situations. What is the issue with antipsychotics? They are very dangerous. Some side effects include loss of independence, confusion, oversedation, increased respiratory infections, falls, strokes. They can cause various other medical complications or even death. They are not FDA approved to treat or manage dementia symptoms. Treatment for dementia is considered an off-label usage, which means the effectiveness of these drugs is inconclusive or weak. In the past, antipsychotic prevalence has been very high in the US. So what has been done so far about it? There has been a campaign called the National Partnership to Improve Dementia Care in Nursing Homes. It began in 2011 and still exists. It is run by the Centers of Medicare and Medicaid Services. In the graph, you can see the start of the partnership at the red dotted line. This starts around 2011 and runs up until 2021. This shows significant declines in antipsychotic prevalence. However, the data does not include residents diagnosed with schizophrenia, Huntington's disease, or Tourette syndrome. These are psychiatric disorders that are actually merited uses and antipsychotic medications tend to be used for treatment of these diseases or syndromes. So how do we know if the uses represented in the graph are even merited? Oftentimes, many residents receive antipsychotic medications without proper diagnosis. So how do we ensure that the antipsychotic prevalence is due to merited purposes, such as someone who medically needs them, and not improper usage, such as sedating a resident to make them easier to handle? We need to provide them with other resources. Through my research, I discovered that higher staffing levels allow for higher quality of care. This means fewer pressure ulcers, lower restraint use, decreased infections, lower pain, improved activities of daily living independence, less weight loss, less dehydration, less improper and overuse of antipsychotics, and lower mortality rates. The problem we are facing is that staffing levels are inconsistent across the country, leading to low quality care that does not meet the needs of nursing home residents. So why does this problem exist? There are no federal minimum requirements for staffing levels in the US currently. There are only recommendations set out by the Centers of Medicare and Medicaid Services of 4.1 HPRD. HPRD stands for hours per resident day. At this point in time, states can make their own requirements. This is troubling though, since levels vary widely state to state, as well as vary within the states themselves. My proposed solution for staffing levels includes setting up a federal staffing requirement minimum that is required for all states to follow. The minimum staffing requirement should be based on residents that are of a high acuity level, meaning they need more assistance. Let's remain hopeful though. The Biden administration announced plans for new nursing home reforms on February 28, 2022. And this included some initiatives in regards to nursing home staffing levels. Another shortcoming I identified through my research was that there's poor worker training existing in nursing homes. Best practice guides do recommend non-drug approaches as the first-line treatment option for behavioral and psychological symptoms of dementia. This is in replacement of pharmaceutical methods such as antipsychotics. Non-pharmaceutical methods involve various behavioral management strategies, environmental modifications, personalized care, and many other strategies. Behavioral acts are usually communicative forms of something going on with the resident, which could be external or even internal. This requires the staff to be adequately trained to, number one, utilize non-pharmaceutical strategies, and number two, to recognize these behaviors as distress signals. The problem we have is that training requirements are inconsistent across the country, leading to low quality care that does not meet the needs of nursing home residents. I've identified that this problem exists because there is no federal training requirement. States can make their own requirements, and these trainings vary widely from state to state. There's even variation within the states themselves. In my research, I analyzed a 2015 report by Justice and Aging and found that there was this variation that exists. The programs vary from state to state in who gets trained, how many hours these programs are, the areas of education that the training covers. One example that was highlighted was Arkansas, which is one of the best states. They include many subject areas that have their own hourly requirements. Massachusetts was also highlighted as the only state to have a requirement that nursing home staff pass an evaluation to complete the training. There are also many states that require training but set no hourly requirements. With these variations, there's so many inconsistencies in the care that residents receive, and this is a major problem. My proposed solution for healthcare worker dementia-related training is that we set up a federal training requirement for direct care workers, as well as a requirement for all other workers in the facility. We must ensure that these levels are met through strict methods of oversight. We need to set a standard number of hours for initial training, set a standard for who receives training, as well as a standard for the number of hours of annual training, meaning continued education. Overall, I've identified that both worker training as well as inadequate staffing levels both contribute to the low quality care we see in nursing homes. We can do better if we address these problems at hand and provide staff with other resources so that the residents don't receive antipsychotics that are not merited. Here are my references. Thank you for watching. I'd like to take a moment to acknowledge my thesis advisor, Laura Reed, and Arlene Germain of the Massachusetts Advocates for Nursing Home Reform group. For any further inquiries, feel free to contact me at Kamryn Oliveira at umass.edu. Thank you.